Good morning. My name is John DeFrancesco, and I'd like to start off by thanking you for taking some time out of your day to listen to what I have to say. And I'll start out with a question. Do you suffer from any chronic pain, headaches, maybe even some more serious diseases like cancer, HIV, or know anyone that does? And another question, what kind of medications do they have, and what kind of side effects do they have? The topic that I'm going to be speaking about today is medical marijuana. I'm going to explain the various advantages of it, some alternative medication that marijuana could actually replace in the future, and why it is currently not legal in the United States right now. Medical marijuana can be a great alternative to some various drugs such as painkillers and chemotherapy, which both have various side effects. And first, I'm going to talk about the various diseases that cancer would be able to treat. Studies show that medical marijuana may be beneficial to individuals that have the following types of diseases: cancer, glaucoma, chronic migraines, chronic seizures, and Alzheimer's. Cannabis is proven to slow down tumor growth and the production of cancer cells throughout the body. And it's also very effective in relieving nausea and vomiting related to chemotherapy and other types of therapy. Some strains of the medical plant actually have shown to decrease the force that glaucoma can place on the eye. So if glaucoma patients actually are prescribed medical marijuana, their vision would be elongated much longer than it naturally would be. And marijuana has been proven to be one of the best pain relievers, which may be very beneficial to migraine sufferers or other chronic disease sufferers. And that brings me into my next topic, painkillers and the various types of medicines that actually treat the diseases that medical marijuana may be able to one day. Prescription drugs that treat various diseases may have some very disturbing side effects, including addiction and possible death. Prescription drugs such as Oxycontin and Percocets that treat pain have many side effects, and according to Ed Pillington, the writer for The Guardian, 15,000 Americans died last year due to prescription overdose. If medical marijuana becomes federally legal, it could potentially replace all the pain medications. And according to several drug rehabilitation centers, 5 out of the top 20 most addicting drugs in the United States are to treat pain and anxiety. So 5 out of the top 20 are actually prescription medications that are extremely addictive. And that brings me to my next topic. Why is medical marijuana not legalized yet? And this is for a number of reasons. And the first one, the Supreme Court has decided that marijuana has no medical benefits worthy of an exception. And according to the White House, the drug has a high potential for abuse, and there are a lack of accepted safety for the use for the drug under medical supervision. Possibly, one of the main reasons medical marijuana is not federally legalized yet is because the big pharma, the top few big pharmaceutical companies, spent an estimated $242 million lobbying within the U.S. federal government in 2010 alone, and some of which was to keep medical marijuana illegal so it would not cut into the profits that they would end up losing with medical marijuana substituting for their painkillers. The government actually believes that marijuana contains other chemicals besides THC that has no beneficial purpose. However, there is a drug right now named Marinol that contains 100% THC, and it's used for patients that suffer from HIV and cancer. So I would like to conclude by stating once more that medical marijuana has been studied by several scientists for many years, and there may be evidence of the medical benefits. As we have seen, the current drugs that treat some diseases that medical marijuana may treat have very severe side effects and may actually lead to death. One of the main reasons medical marijuana is currently illegal, as I stated before, was because the big pharmaceutical companies are lobbying to keep it illegal so they will not cut into their profits. And no one knows exactly what the outcome of this may ever be, but however, it will continue to cause controversy and debate regardless of what the outcome is. And let me leave you with one final thought here. Do you know in the 19th century, marijuana was widely used to treat menstrual problems and other various diseases? Actually, Queen Victoria used this for her menstrual problems, and that was prescribed to her by her physician, J.R. Reynolds. And he quoted, "When pure and administered carefully, marijuana is the most valuable medicines we possess." So I'll leave you with that, and everyone have a great day, and thank you for taking time out of your day for listening to me.